Welcome, everyone. My name is Sujina Perajuli. I'm the program specialist for the Integrated Healthcare Initiative here at Mental Health America of Greater Houston. Thank you so much for joining us today. We have an amazing presenter lined up for you today. We're going to have an amazing session, but as always, before we get started, we would like to start with doing brief introductions around the room. So I just introduced myself. I'll pick William next. If you could just give your name, your title, and the organization that you come from.
My name is William Lyons. I work here at Legacy Community Health as our program is called Health Connect. And yeah.
Thank you, William.
Are you going to facilitate who goes next?
I will pick, I will just, it'll be easier that way. Philtasia, you're next.
Hi, my name is Philtasia Chavez. I am the Behavioral Health Case Manager at Access Health.
Thank you for joining us today. Roslita, is that you from Su Clinica? I'm sorry if I mispronounced your name.
Yes, it's me. I had already typed in my info.
You have
me from Su Clinica down South Texas.
Rose, thank you so much for joining us today. Mary Luz, you're next.
Hi, my name is Mariluz Martinez. I am with University Health in San Antonio, Texas, and I'm an Assistant Director of Population Health.
Thanks for joining us today. Dr. Zaidi, you're next.
Hi, I'm Dr. Zaidi. I'm a pediatrician at Access Health in Stafford, Texas.
Thank you for joining us today. Lorenzo, you're next.
Yes, my name is Lorenzo Moore. I'm the Executive Director of Socio-Emotional Learning and Culture for Aldine Independent School District here in Houston, Texas.
Thank you so much for joining us today. Daniel, you're next. Veronica, you're next.
Hi, I'm Veronica Mesa Hernandez, behavioral lead at Centerwell Primary Care with Humana.
Thank you for joining us today.
Thank you.
Daniel, if you're here, if you want to unmute yourself and introduce. If someone just joined us, Jay Harris, if you want to unmute yourself and introduce yourself.
Good morning, everybody. I'm Jade. I work for Access Health, and we evolved the team as the health systems administrator.
Thank you so much for joining us today. Adriana, I know you just joined us, but we're doing round of introduction. If you want to introduce yourself.
Hello, everyone. Adriana Garcia, Gateway Community Health Center, and I am the Director of Behavioral Health.
Thank you so much for joining us today. I think I got everyone. We have another one just joined. Beanie, I'm sorry if I'm mispronouncing your name. If you want to introduce yourself.
I'm Delwyn Bean. I'm with Community Health Choice.
Thank you so much for joining today. All right, without any further ado, I want to introduce you to Florence Gerber, who is our presenter today. So Florence, floor is yours.
Thank you for having me. So first of all, I want to see how y'all are doing today. It's a smaller group. Usually there's like 20 or 30, but if you are brave enough, I absolutely welcome you to share your faces. Otherwise, use your emoji. Let me know how you're doing. Thumbs up, thumbs down today are kind of so-so to kind of give me a gauge of how y'all are feeling. Good. We got thumbs up here. Okay. Okay. Good. Anyone else want to just kind of share with me how you're doing? Good today, down, so.
William, you have a shock emoji.
Well, I'm doing really well. I want to thank you all for having me. What I'm going to be presenting is my passion, my love, and 25 years of my career as far as operations and quality improvement. One thing I do want to let you all know is this is all for you. So I designed it to be engaging, which means at any time, if you have a question, please shout it out right away. And I'll go ahead and look at the chat, but Sajina, if there's something that I don't see in the chat, please let me know. And I'm hoping by the time I end, you guys could have at least one takeaway that you could bring back to your work area or even in your personal life, who knows? But once again, this is really for you and making sure that if you have any questions to ask right away. So what I'm going to do is dive right in. And let me start in the beginning. So what we're going to look at is the agenda. We're going to spend some time, some introductions, which we did. I'll introduce myself real briefly. To the two objectives that was asked of me to present is identify stakeholders in the success process. Importance varies by department. The second objective is to identify markers or metrics for clinical success. And then I'll provide some practical application. I believe that unless there is some examples to share what all these theories and methods are, it really makes it difficult for the receiving end or the learner to comprehend it. At the end, I'm hoping to have an open dialogue, but I'm going to go at the pace depending on what the audience is going to need. So if it looks like certain sections require more time to talk about it, great. If not, then we'll just breeze right through that area. As you can see, there's a light bulb, a pencil, and this, I guess, 3 heads, if you will. And if you see this in my presentation, I'll give you a visual of what that area is going to be about. If it's a light bulb, it's a concept to just think about. If it has a pencil, that means we'll have you take some time for individual practice on that methodology or theory or concept. And then if you see the little heads here, that's a time that we'd really like to have a group discussion, or I'd like to have a group discussion to get you all's input on that particular concept. I'm a firm believer that we learn from one another, so shout it out, but at the same time, I don't want you to feel obligated as well. This is your learning, not mine. I'm here to really just be a service to you on these concepts that I'll be presenting. Any questions on the agenda so far? Okay. Now I'll ask questions and it'll be like a yes, no. And if I don't hear anything, I will assume everything's good to go and I'll keep talking. So a little bit about myself. I am a quality performance improvement practitioner. So the stuff that I'm teaching you today or presenting, I do practice regularly to this day. I consult, which means if there are organizations or individuals that need my assistance, I'm there to really guide them. I teach and educate on this, and I'm also a coach. So I've helped organizations. Once they're really ready to start applying this, I go in and just really provide some coaching and practical guidance on what's going on. I've had 25 years of operational experience, and really it's in government as well as academia, and particularly in healthcare operations. I love this, it's my passion, and I really believe in healthcare and in government needing to really think about a different way of doing business or operations to streamline and really take the current resources that we have and finding out how we could, I'll say, redesign it to have a more effective and efficient operation practice. Okay. What I have here is just a list of attendees that I was informed will be attending. So the way I designed this course is to make sure that I can provide some information on all these aspects, from clinical to operations to frontline staff as well as clinicians, and even a combination of those particular roles depending on where you sit within your organization. Okay, you guys ready to go? Okay, So what I'm going to do right now is really break down what those two objectives are. So the first objective is identify stakeholders. Stakeholders are internal and external customers. Now, some people go, Flo, what are internal versus external? Internal customers, they're employed by the organization and they're essential to a process flow. External customers, they're not employed by the organization, but essential to a process flow. So I'm going to stop share right here, and I'm going to ask the group, what's an example of an internal customer given your particular role or title in your organization? Just shout it out. So someone that's employed by the organization and you interact with to get your work done.
Call center.
Perfect. Yep, the call center. Exactly. What's another example?
For me, it would be our maternal fetal medicine team.
Perfect. Okay, thank you. Let's do one more example of an internal customer that's employed.
Patient services.
Patient services, exactly. Now I'm going to go on the flip side. What's an example of an external customer, not employed, but we still need to interact with in order for us to care for our patients or do the work that we need to do given our particular role? Oh, can I have you unmuted? Is that? There we go.
And federal regulators.
Absolutely. Federal regulators. We cannot ignore them. Maybe a couple more examples.
Community-based organizations like the Houston Food Bank.
Yep. Yep. Okay, let's do one more.
What about like insurance companies?
Yes, insurance companies, whether they're any payer, that could be commercial, such as Blue Cross Blue Shield, even Medicare, Medicaid, exactly. Insurance companies, yes. So the reason I'm bringing this up is when I work with organizations, I say, who's your number one customer? And they usually say the patients. But if you could imagine, if we don't take into consideration examples of internal, external customers that you all just identified, it's really going to be a hindrance for us to really work together and perform to the best of our ability operationally to provide that service for our patients. So if we can't get along internally, for example, if I can't connect with the call center and have a relationship with them, you could imagine that could be a hindrance to actually provide the service. Okay, so we'll go into detail a little bit more about that. So the next thing I want to do is break down the next section. So those are the stakeholders. The next one is in the success. So success, really, we're going to have to define that. And really what this is we are going to have to figure out how we're going to define that a process flow is going well or not. So typically what that looks like is some kind of measurement. So I'll go over that real quickly on this slide, but we'll go into detail about it. The next one is a process. So what's a process? A process is a series of steps to achieve a specific objective. Okay. Now, the reason I'm doing this is we're going to go ahead and look at a big picture and we'll start funneling it down to get more specifics. But I want us to be on the same page as far as what these definitions are as it relates to the objectives. The importance varies by the department. So the department, I'm going to say, is a group of individuals within an organization to support that process flow. And they're going to be important because they're going to affect and really play a critical role in that process flow. And as we have just demonstrated some examples of internal customers, it could be the call center. It could actually be finance, accounting, electronic health record, if you have that department. Okay, any questions on that one so far? Otherwise, we're going to go to objective number 2. Great, so objective number 2, the way we're going to look at this is we're going to identify metrics or markers. This is specific data and visual reports to help us look at information and help make decisions. And then it's going to be for clinical successes. And this is going to be positive processes and patient treatment outcomes. So that sounds like a mouthful, but I'll go over that in detail as we proceed with the slides. So what we're going to see here is a couple of process flows, and these are pretty standard in the clinical setting. Now, it's a lot of information here, but we're going to break it down. So the first one is the patient care. Now, the model that I have here is client and staff experience, and I call it systems thinking overview. Systems thinking overview means that we need to look at all the different areas that's affected by this particular process flow. Just like when a provider looks at a body and they evaluate that particular patient, it is a system. So in this case, when we're looking at the patient care process flow, it is a system. There are critical pieces there depending on where you sit as an employee or as an internal or external customer for that process flow. So the way this reads is that on the left side, you're going to see customers. Now, these customers are internal or external. Then there's a process, and this is represented in the yellow area. So a process, there's going to be roles and responsibilities. We do things, there's objectives, and then eventually, depending on that customer need, whether it's internal or external, they're either going to have their needs met and they'll be happy and we want to sustain it, or it's not meeting their need and we have to improve it. So that's the piece we're going to be looking at here. Within a clinic, there's operational leaders, and then those leaders are the ones that oversee this and help support what's going on. So if it's going well, let's go ahead and still be champions to continue that work. And if it's not going well, we're going to need to really lean on the leaders to determine how we can improve things. So in a nutshell, the process is you schedule an appointment with a client, they check in, we room them, they have a visit, whether it's with a primary care provider, whether it's with a behavioral health clinician, or even a nurse for diabetic education. And then the patient ends. But within this process, the client and staff, they experience their own perspective depending on where they sit in this whole entire process flow with the systems thinking view. So this is the patient facing. Now, behind the scenes, there's this process flow, which is the patient care revenue cycle. Now, what is this? Well, what it means is that in order for any patient care process to happen, we need to financially stabilize ourselves. And that means looking at how money comes and goes. Typically, it starts off with the contract, and you'll see it in the oval area. So these are understanding contracts, whether it's with insurance companies, Medicare. Sometimes you have grants. These are the ones that help fund the operations from a clinical process flow. We got to look at fee schedules, the grant requirements, depending on this situation. There may be provider credentialing, financial setup. As you can see, there's a lot of areas here under contracts to really understand it. Now, I could do a whole lecture about just this one thing, but just imagine that each of these could be its own separate process flow. And then once you have a contract, okay, great, we know what the expectations are, we're going to see patients, and then we schedule an appointment. And within that, it has its own little details that we need to be very knowledgeable about when we schedule them. Depending on how you schedule an appointment, that particular organization may need to do an account setup, may need to know eligibility, and perhaps even do reminder calls. It might be in an appointment center. So within that, you have all these process flows for this particular task of scheduling an appointment. Okay, then they go to the patient visit. This patient visit is what we just reviewed over, which is the patient care process flow. So they check in, for example, they complete registration, there may be payment agreements, there may be co-pays, and then there's the visit itself they have to document and maybe do all these codes depending on the diagnosis as well as the treatment plan. So typically the clinical staff is the ones that are really involved in this particular area. But it doesn't stop there. Now we have to submit those claims. or connect back to the payer, whether it's a grant funding organization. And then they need documentation to justify what the service is. Perhaps compliance with contracts, making sure the codes align with the patient visit that aligns with the diagnostic. And then assure that the whole entire documentation is definitely up to par and it actually represents what happened with that patient visit. Well, it doesn't stop there. We need to do accounts receivable. What this consists of is, depending on the payers, we need to make sure that we are in contractual compliance. And then we could talk to them and say, hey, we need XYZ dollars sent to us because we fulfilled that contractual obligation. Maybe we need to talk to our patients or our particular payers because credits need to be actually administered into that account. And then there's the whole accounting system. And then typically this particular area is done by the business services or administration. Now, this is a lot said, but what I wanted to demonstrate was two key process flows or areas within clinical care. The one is really patient focused, which is the patient care process flow. In my practice, we cannot ignore this concept of what I'm calling the revenue cycle to make sure that we are getting the money that we need in order to stay in business to take care of our patients. Okay, I'm going to stop right there. A lot to take in. Curious to know what the first reaction you have once I ended that piece on that slide. Maybe a couple of people could share their initial reactions.
What came up for me was competing interests. So the idea of everyone has their own stake in the flow. And so I can imagine my part of it being most important because it's patient facing, but then another part of it, well, I'm making sure we get reimbursed for whatever you're doing. So kind of competing interests about different aspects of the flow.
Yeah, thank you. Yep. We all connect to some degree when we come to look at the whole systems perspective. And that's the key here, is that when we're doing our work, I don't know if y'all hear this, but we say, or I hear, oh, we work in our silos. Well, the systems thinking is a way to look at it and get out of your silos. Even though you're scheduling that patient appointment, and let me pull up this particular slide again. You're this person that's scheduling this appointment. Do you see it here on the first slide? You're scheduling this appointment. But if you look at all the arrows, this is the direct or indirect connection that that person has. So it's really essential for us to look at how important our job is and to make sure that we do it as designed per the process steps, because that's what's going to guide us to make sure that everyone else in this whole system understands and knows what to expect. Okay. Maybe one other person to share what their initial reaction is with that slide. William, thank you for chiming in. No other thoughts? Anyone felt a little overwhelmed? If so, put this emoji up if you felt a little overwhelmed, because it's a lot of information. Okay, so I'm going to go ahead and move on here. So we talked about all the various objectives that we're going to be looking at. Just wanted to demonstrate two process flows here. The next slide that I'm going to share with you is, remember that section that mentioned all the departments? Well, not only are we looking at each other and the roles that we play from a systems perspective. Once again, system is just looking at how one affects the other. Just like if a doctor were to evaluate a whole entire human being, there's a lot of intricate factors that we need to look at. So what this slide is saying is that there's a start of a process, or let's go ahead and look at the patient flow. The start of the process is scheduling an appointment. The end of the process, in the example, is we're done with the patient visit. But when you're looking at the process flow itself, process flow are distinct steps to get from point A to point B. We also need to look at all the various departments or units that support all the different areas and the steps within that process flow. So I provided some examples here, maybe human resources, because there is a union within that organization that we need to consider, and how that particular process flow affects union laws. Information technology, because we need a laptop or a hard desktop to do our work. Electronic health record to document all the variances in that patient care. Compliance. So the way I'm going to define compliance here is really to make sure that we're meeting regulatory obligations, finance, accounting, and that can link to perhaps how billing is done, infection prevention, to make sure that we're following CDC guidelines. Quality, some organizations have a quality department, and this is where I've seen some organizations actually have quality improvement fall under. Lab, to do any kind of tests such as A1C, and even the call center. Now, I've just put out some examples of departments. What other departments can you think of that's not on there that really would affect any particular process flow within your area of work?
Would you mind putting the slide back up?
Yeah, absolutely. There you go. What's another example of a process? I'm sorry, another department that would affect your particular role and processes within your area?
I think maintenance.
Oh my God, thank you for bringing that up. Maintenance, janitorial services. Oh, I'm so glad you brought that up, because yes, if they're not there to help maintain facilities, I'm thinking facilities, is that right?
Yes.
Yeah, so important.
I was also thinking about pharmacy. We have an in-house pharmacy that's also a huge part of the work we do.
Yeah, exactly. Maybe one more that's not on here that's been said by one of our colleagues on the call.
Also, related to information technology, that may be more like equipment, and there may be a separate department for analytics, running all of your reports and maintaining your data, which is really important.
Exactly. So under information technology, there's the hardware, such as our laptops, our desktop, and maybe even telecom, depending on how that structure is in that organization. Information technology also has the software. So for example, if you're using Google or Microsoft, or even the software of HR like Workday. But you're right, under information technology, we're looking at how to actually mine the data, create the queries, get the data out, and even put it in a visual format. Absolutely. So the reason I'm pointing this out is when you're looking at a process flow, you got to have a start and an end. You need to look at all the people that it affects, internal and externally, but do not ignore the departments within the organization that it affects. And this is really an important part of identifying an opportunity for improvement, because if you don't take this intentionally, you might oversee or neglect an important department or a customer that is essential to the process flow within itself. Okay. Any last minute questions before I continue? So we're going to talk about how do we measure success. And the key performance indicators or measurements or targets, there's many names for it, is one way to actually have a way to identify success. What I've done here is I've identified two areas. One is called process outcomes and the other one is patient treatment outcomes. The biggest difference between the two, the way I'm going to identify it and when I do my work, is that when you're looking at process outcomes, it's really looking at that whole entire start and end, and where are specific areas that we can get data. And it's not specifically targeted towards the patient treatment, the patient diagnosis. The patient treatment outcomes are the ones that typically happen during a visit. And it's a way for us to measure how well we're taking care of that patient in addition to that population or population health. And this is typically geared towards the patient, some kind of diagnosis, the treatment plan, screening. So these are some examples that I provided. I'm going to go back to the process outcomes. I'm going to go through all of those particular steps that actually are within the patient visit. The first one is you schedule an appointment. So an example of a process outcome is the call center where they make an incoming call. What's the abandonment rate? What's the wait time? And what's the call time? When I work with my clients, these are the top 3 that people say, but then I like to actually dig a little bit further, because even so we say abandonment rate, we need to be more clear about what that definition means. In this case, I will say something like, I want us to define what the denominator of this particular process outcome measurement is, and what's the numerator. So that'll help us generate the data. Another question I may say is, when we run these reports, what time frame are we looking at? Are we looking at it per week? Are we looking at it per monthly? Are we also going to look at it by clinic? Are we going to look at it by the whole entire organization? So it's really important, even though we have this idea of abandonment rate or wait time or call time, we also need to look at the numerator, denominator, and how we're going to actually generate the data. Once we identify what the criteria is, that's going to be the standard criteria that we use throughout the duration of whenever we actually run that data. Any deviation from that criteria will actually hinder the report itself. So this is where I like to say, when you run data, it needs to be reliable, it needs to be able to be repeatable, and it has to be relevant, the 3 R's. And if data seems to be more of a debate versus something that could be data for decision making, then I will advise my clients to say, is it repeatable? Meaning that, is it something that's constantly a query that is used because there's no deviation from it? Is it reliable? That means, yeah, I trust how this data is run. And is it relevant? Organizations that I work with have a tendency to have hundreds and hundreds of measurements. But I want to push back and say, out of all these measurements, which one really counts based on the process outcomes and the patient treatment outcomes? So another example that could actually be in place for the process outcome is arrive on time. Did they come in late? Did they show or no show? Another one that could be process outcome is lobby wait time and the duration that they're actually rooming that patient. Now I'm going to jump on over here to the patient treatment outcomes, and there's several of them here. I'm not going to read them all, but it'll give you some examples and you may know of this. Welch Health visits. But similarly to what we're looking at process outcomes, we need to look at what the criteria is. Welch Health visits, what age, depending on that data that you're generating. Developmental screening, depends on that particular developmental screening. Up-to-date immunizations for adolescents. Various types of screening such as CRC, colorectal cancer screening, cervical cancer screening. Now, some of the clinics that I've worked at also, they look at dental. And so one of the measurements is topical fluoride varnish or even prenatal care. This link that I provided down here, and you will get these slides after this presentation, is in, oops, pardon me, let me back up here. This particular link right here, it's actually going to take you to what we call CCO metrics in the state of Oregon. These are care coordinated organization metrics. What these are, in a nutshell, is that in the state of Oregon, we have quality measurements, meaning that if we decide to be part of this quality incentive program and improve the overall outcome of these various measurements, there are quality improvement funding available. But these are several more examples that you all could look at as far as ideas for any type of key performance indicator. Okay, I'm just going to scroll a little bit so at least you all could see this, and it's being recorded, and perhaps if you view the recording, you'll be able to see all these various key performance indicators or measurements that's been used here in the state of Oregon for CCO metrics. Okay, I'm going to stop right there. Any questions so far as measurements are concerned?
Florence, can you give an example of how the denominator numerator conversation will come out of the information you're getting back when you're looking for that?
Yeah, so Veronica, could you tell me what your role is? So at least when I respond to your question, I can.
Behavioral health lead for in a senior primary care value-based clinic.
Okay, so let me share my screen here. Do you guys do PH or depression screening at all? Okay.
We do.
Perfect. So here's going to be the scenario. I'm working for a clinic ABC. And in our process, when they come in to be roomed, okay, that particular CMA will go ahead and say, we need you to complete this PHQ-9. They complete it. Once it's done, it goes to the behavioral health clinician. So that's one example of a process flow. When we look at the data, we would go and say, okay, we're going to run the data. We need to know the denominator. The denominator is going to be that population size. So if we're going to look at it for the whole clinic, we're going to say any individual that has completed a PHQ-9. Then we could say we're going to look at a target population. And we're going to say we're going to look at individuals that identify themselves as prenatal. That could be the numerator. And then we could say, okay, we're going to monitor this from a population health perspective, with the denominator being anyone that's taken the PHQ-9. The numerator is anyone that's actually taken it and they are identified as someone who is going through some kind of prenatal treatment or care with a primary care provider. You could monitor that from a population health perspective and say, you know what, we're realizing that there's a high depression rate with our prenatal population. And depending on where you go with that particular PHQ-9 data, you could say, yeah, we're going to improve this, which means that we're going to start doing quality improvement initiatives for this population. And that could vary from, yeah, if they come in and they have a PHQ-9 and they actually are identified as being depressed, we're going to do a warm handoff to a behavioral health clinician that's actually in the primary care clinic right now. Okay. And then with time, you could go ahead and say, yeah, the PHQ-9 after 6 months of quality improvement changed because now we're doing a warm handoff to a behavioral health clinician. We're realizing that number is actually getting better. Veronica, does that help answer your question?
Yes, it does. Thank you.
Yeah, and there's much more. Now, the other thing is I want to offer myself as a resource. So after I'm done with this, please don't hesitate to contact me. My email, as well as, I think my email is on these slides for you to reach out. Okay, any questions about this? Yeah, absolutely. Any other questions about this slide? Okay. So here are just some example of visual reports, and really, as someone mentioned earlier, it depends on your data team, but know that typically bar graph is what's provided. But no, there's other graphs out there that can tell a different perspective. So a line graph helps look at trends. And sometimes what I realize with data is it does not have a target to show the person that's reading it to say, yeah, this is the target. And we're seeing a trend that, yep, we're going upward as far as meeting our target. So that's one recommendation, is to put a target line so the reader could understand what's going on. A pie chart is also very helpful. This particular pie chart example shows the demographics of ethnicity. So if it's red, it's Hispanic, but once again, a different way to represent information depending on the person that's reading it or the audience you're presenting to. The other thing that I also recommend is a dashboard, because sometimes what happens is all this data is on one piece of paper. So one bar graph, one piece of paper, one piece of paper for a line graph. Maybe working with your data team to see if you could actually create what's called a dashboard, and it actually provides multiple data information or visual on one page. And it makes it a lot easier, especially for leadership, to look at things instead of going through so many different pages. And then the other thing, as far as visual reports, is making sure that it does give you the trends. Because sometimes some data that I see, it's just, let's say 3 months worth. But if you have like a whole year, it's really, really helpful to look at all the different things that's happening. So for example, I was overseeing a flu shot clinic. And so I knew during the flu shot season that I would need more staffing, if you will, than if it was a non-flu shot clinic. So I was able to plan and do quality improvement initiatives to be able to make sure that I'm able to get more CMAs or certified individuals to do injections. But if you could imagine that data, if I only have 3 months worth of information, it would not show me the story to say, yeah, during flu shot season, I need more information. And that information I could take to senior leadership to help justify why I need more staffing. And you'll be more proactive at it instead of waiting last minute as well. So the question I have for the group is this: what are examples at work in which information was provided on a visual report, and what did it tell you? And this is a way for us to share what we use, and perhaps as someone shares, we'll get something out of that dialogue.
So one thing I've noticed is many times people are very good at presenting quantitative data, so they can give you the numbers, but there's no trend.
Yes.
And without a trend, then you just have the number of occurrences. So you don't get a full picture.
Exactly. Yeah. And when I work on quality improvement initiatives, that's where there's a change in hopes that there's going to be an improved outcome. And so I'm sorry, what was your name? I think I missed it.
Delwyn.
Delwyn, thank you, Delwyn. So as Delwyn was saying, yeah, the trends are really helpful because data is for decision making, and data is only as good as what you provide. So yeah, absolutely, trends are very helpful in dialogue. Okay, someone else I think had something to share as far as data that they use, and what information did it say?
This is Mariluz. So one of the challenges that I face is having a lot of data that's collected around the outcomes, but having that tied to processes, right? So that we can break down that big number into daily or weekly activities. And we developed a monthly metrics, but we're still challenged with, okay, if we are at one of our measures is 55% of our patients are attending their maternal visits between 10 and 13 weeks, and we're really at a place where we need to address that. How do we tie that to the processes on a monthly metric version so that we can work towards improving that outcome? Do you see what I mean?
Yeah, so let me make sure I understand. So this example is that 55% of your clients attend maternity and there are 10 to 13 weeks. So the first thing is I would identify if it's a process measure versus an outcome measure. Okay. What I'm hearing is that's actually a process measure because you want them to come in. An example of a clinical patient outcome is that they come in and they get, now I'm not a clinician, so please, one of the clinicians chime in, but when they come into, let's say at 13 or 10 to 13 weeks, there are specific clinical diagnostic or lab work that's done. And then
Okay.
depending on that, that is where you do clinical QI work versus process.
Got
Is
it.
that
Thank
Mary
you.
Lou? Okay, yeah. Okay, I'm glad that helped out. So any other questions here that you may have about this particular slide as we're looking at the data? Yeah. So the biggest thing here is really determine if it's actually a process versus a patient outcome. If it's a patient outcome, I would punt that over to the clinical people. If it's process, that's more operational. The two go hand in hand though, because if you improve operations and you get them in, then now the clinician could do their job and help them in their treatment, or in this case, maternal child care, and making sure that they get what they need during those milestones.
Yep, exactly. Thank you.
Yeah, absolutely. Okay, let's go on here. The next slide I have, let's make sure. Okay, so we're gonna focus on the patient care. Now remember, there's the revenue cycle, which is its own animal. But for the sake of using what we're looking at as far as objectives, we're gonna stick to the patient care process flow. So we're gonna look at from the patient visit perspective. So this is going to be something that you're gonna write on your own and then reflect, and then we're gonna share back. So we're gonna look at this huge process from scheduling a visit to when it ends. But we're gonna take one segment of this process flow, which is the visit itself. So on your own, I want you to identify, let's say that you are a clinician and it's a primary care clinician. The patient that's coming in, and since we brought this up, Mary Lou, it's a patient that's coming in for a 10-week appointment. You're a physician, you're a primary care physician. Who are the internal stakeholders and external stakeholders? Just identify two for this practice. We're going to define success. So we're going to look at process outcomes and patient treatment outcomes. So come up with at least one or two for each one. And then identify the departments that will support the patient visit itself, so that if you have any discussions or resources that's needed, what are those departments that you would identify? Does that make sense for this practice? Okay, so I'm going to give you a couple of minutes to just think this through. And then when we get back together as a group, we'll just go under each one and have a discussion and see what people come up with. And if there's questions in that discussion, it'll be an opportunity for us to learn together as we discover anything else in that conversation. So I invite you to go ahead and practice this particular exercise. I'll be back in a couple of minutes. Okay, group. Let's go ahead and share what our responses are to this. I'll keep the slide up as a visual for you all to look at and if you need it. Let's look at the patient visit. And remember, we're primary care providers here. We have a patient that just came in between 10 to 13 weeks of the pregnancy. As a primary care provider, who are my internal customers to help me with this particular process or this task? Just shout it out.
Your staff checking in, patients, people getting them into the rooms.
Mm-hmm. Exactly. Okay. Maybe another person that can share an internal customer to help get your job done in this particular area as a primary care provider.
Our medical assistant group.
Yeah. Medical assistant. Yeah, absolutely. Maybe one more, if there's someone else that wants to share what they thought of.
Well, I know for our clinic, we do S2A screening. So I would say our interns who would complete screenings for any food, housing, or transportation needs for that particular patient.
Okay. And are those interns actually paid interns that are?
Some of them are paid, yes.
Okay. Yeah. Now, the reason it's so important to distinguish internal versus externals, because if they're paid, then we know that they have the same departments or resources that we would have as colleagues. If they're an external, let's say intern, and they actually are coming from a specific school, it tells a totally different dynamic because now we have to look at the other external factors if we have questions, and those are resources outside of the organization. But that's a great example, interns to help with this visit. Now, the other thing that may seem very minor, but when I've done site observations, is sometimes they have the front desk staff actually go in there and help print out forms or stock any of those immunization VARs that need to be distributed. And they are part of the visit as far as how it impacts that PCP, because let's say that there's a VAR that's needed and it's not in the room when the PCP needs to distribute it because it wasn't distributed for whatever reason. The other one that may seem very minor is sometimes there's an individual that helps make sure that things that are posted in the exam room is up to date. I've done site visits where there were charts there that were literally over 10 years old and they weren't valid anymore. But there's someone within the internal team that is assigned or needs to be assigned to make sure that the information in the exam rooms are up to date and maybe even standard, so that when one particular provider goes to one exam room, it's the same look and feel as another one, so they know where things are. Okay, let's jump into external customers. What would be an example of an external customer in this particular case of a PCP?
First of all, the patient is an external customer. The payer, if the person is covered by commercial insurance or other funding.
Yeah, absolutely. So the patient definitely, and that patient, depending on the organization, might actually complete a patient satisfaction survey or a client satisfaction survey. So that within itself, by looking at it and knowing that this patient is going to help evaluate my customer service, you know, we need to make sure that we treat them as someone who's very valuable, not that the other ones aren't. But when we start thinking this way, it allows us to look at what else can this particular external customer, in this case, a patient, what else will happen in their world to impact my life as a provider. So in this case, knowing that they may complete a patient satisfaction survey, that helps us in our evaluation of how we provide our services. That could be a report to our grant funding. And I know sometimes insurance companies want that information as well. Okay, the other one that you had mentioned is payers and insurance companies. So yeah, as a PCP, I need to keep that in mind so that when I'm actually charting my notes in the electronic health records, I need to keep in mind that they're the ones who's going to receive this information. And to make sure we're in compliance with HRSA or any type of Medicare documentation, that's really critical. I've heard enough stories just, where organizations have been audited because of coding, which doesn't align with the dictation or whatever that supporting information is for that visit. So yeah, absolutely. What's another example of an external customer?
What about like our internet provider?
Yes.
I feel like for us, we obviously have an in-house IT, right? But we are dependent on that the service is good for us to be able to chart and see our patients in an efficient manner.
I love that you said that. I've worked with clinics that they're not in a big system-wide system, their role, and that is very critical, is for them to understand and know who the internet provider is. So if something were to happen because of an outage or whatever, they know where to go. So absolutely important. Yes. What this exercise does is does critical thinking. And when you're working on a quality improvement on any process, these are questions that I invite you to ask. And these are guiding questions for the quality improvement team to think about, because one may not have thought about, oh yeah, we're a rural clinic. And yes, we need to really understand how we get a hold of our internet provider. Thank you. Okay, so let's dive into the next section here. What are process outcomes that we could use from an operational perspective to measure the success as a PCP in this visit? Kind of tough.
I would say maybe the patient didn't have to wait much to be roomed, and that the pre-visit information was completed completely and effectively before I entered the room.
Yeah. I recently encountered an issue, and electronically, depending on clinics, they have a coding system. So in Epic, which I don't know if some of you use, you could actually use specific colors to say green. If you see green next to the patient's name, that means they're here. Well, a patient was sitting in the waiting room and sitting in the waiting room and sitting in the waiting room and ended up leaving. And so after a while, one of the MAs was thinking, what happened here? So yes, that definitely is an example of a process outcome that, they're roomed and they're not waiting. But if there's any issues that come about where it has a negative or adverse outcome, in this case, the patient ended up leaving, that is an opportunity to do a quality improvement analysis and determine what could be done differently. You would go through the same exact process that we're going through right now, who are the internal versus external stakeholders. And we're going to use this particular measurement because once we do an improvement and make changes, this is not going to happen again. That's the theory behind it. Yeah. Okay. What's another process outcome measurement that we could look at?
This is Mariluz. So in our practice, we started looking at the number of patients that call in to confirm that they're pregnant as the starting point, but because some of those patients, before they even schedule a prenatal visit, they need to confirm that. So if they didn't come in, what happened? And trying to support the patient, because you never know what could have happened that they are not coming in for that appointment.
Yeah, absolutely. And I've worked on an improvement project that way, because after looking at the numbers, yep, they're not coming in, the patients aren't coming in. We started digging a little bit further, other, what I call them ad hoc reports, because there may be standard reports that we look at, in this case, patients that come in for a visit. But depending on a quality improvement initiative, we might need ad hoc reports, and these are reports to help with that improvement. And what we determined was specific economic, social class, they had difficulty actually coming in. And so an improvement that we actually, it was already in place, but people didn't know that it was even an option, was to provide vouchers for our patients to get a ride. And what came out of that improvement initiative is that when people were training at the front desk, that was something that was overlooked as an option to actually have and discuss with our patients if they had issues with transportation. So thank you, Mary Luz. That's a great example of patients not coming in, and how you could take that process outcome measure and do something with it to improve and make it better for the future. Okay. Now, this is for the clinicians or non-clinicians, but if this patient's in here, they're person that's pregnant, what's a patient treatment outcome here for this visit?
Well, if you're asking me specifically about that, I would say that, they are scheduled for prenatal care. They're confirmed pregnant and scheduled for prenatal care.
Mm-hmm. Yeah. So that one would be, for the scheduling piece, I would call that as a process outcome, but perhaps, once again, I'm not a clinician, if they get labs done for that milestone in their pregnancy. And so the clinical patient outcome would be that piece of making sure the labs are actually completed at certain milestones. Yeah.
That makes sense. Thank you.
Yeah. So, and this is, I think, the tricky part, is determine what's a process versus a patient outcome, because the dialogue will be different. And if it's a patient treatment outcome measurement, then I would definitely bring in a clinician that comes in to really determine what's going on here, because the two go hand in hand. Once again, let's say that they needed some kind of urine analysis for a specific milestone. Well, they need to be scheduled. If it's not scheduled, then that means we can't get the results. And that means we can't treat them or do whatever we need as clinicians to address or actually follow through with that particular milestone in that pregnancy. So what's another patient treatment outcome here?
So it could be even something as simple as reducing your no-show rate, or improving the rate of your patients that show up for their appointment.
Yes.
Would you count that as an outcome?
It would be an outcome. Would you identify it as a process outcome or a patient treatment outcome?
So I guess that would be more of a process outcome, unless you have such a problem with no-shows.
Yes, that's true. Because if they do a no-show, now it's affecting them from a treatment perspective.
Exactly.
So the dialogue I would have there is, if we look at our data and we notice that the no-show is with our pregnant patients that are within the first 3 months of their pregnancy, now it's affecting the patient treatment outcome, because our standard practice in this clinic is that they need to actually see a dentist for oral examination. Now it's affecting the clinical outcome. So the two go hand in hand, and very important to identify who needs to be in the dialogue depending on the outcome measure that we're looking at. Okay. So last but not least, let's just shout out departments that would support me as a PCP taking care of this pregnant patient. Just shout it out.
I would assume your OB, GYN service line, either chief officer or manager.
Yeah, absolutely. I would say referrals also. I worked on a project where during the visits, they would have patients that would ask, okay, which hospital am I going to go to? Am I going to be referred? Do I have to go to a specific one? And so we would punt those over to the referral coordinators or people that could help determine where that is for the patient and options. Yeah. Okay. The other thing I would say for this one is another department is the supply, medical supply department, because if there are specific medical supplies that's needed in the room and it's not there, for example, if you're doing an exam, it's like, wait a minute, I have an issue with this particular item. Well, we need to determine which department that is. And in this case, it would be that particular medical supply department. Okay. So I'm going to stop sharing right there. I'm just going to get a check in here. How was this helpful for people to really just pinpoint a specific process and go through that exercise? Yeah. So use your emoji. Yeah, so this sucked, or oh, I already knew this. Awesome. Thank you. I would say the hardest part here is just really determining the process outcome versus the clinical outcome. They do go hand in hand, absolutely. Okay, so what we are going to look at, and we're not going to do it, but I want to point it out, but the same exercise could happen when we look at the revenue cycle. The only difference here is that when you're looking at defining success, it's going to predominantly be more process outcome, because all the clinical outcomes is going to be at the patient visit. So if you're inclined to, after we're done with today's learning session, look at the patient visit here, but it's going to be through a different lens of somebody who's going through the revenue cycle. And in this particular situation, I would look at it through the lens of someone that is at the front desk. So if someone's coming in at the patient visit and I'm a front desk person, checking them in, go through the exercise, maybe have a dialogue with a colleague just to brainstorm and practice these skills, but identify, I'm a person that's checking this patient in. Who are my internal customers and external customers? What are the process outcomes? We've identified some of them already. When they checked in, where they arrived on time, was there a no-show? And then identify some departments that would be needed to support my check-in process. Okay. Now, the last 15 minutes, I'm going to share with you a very comprehensive QI project that I worked on. There's a direct link to it, but I'll walk you through what the main elements are that ties into the key objectives that we talked about. But if you're interested, it is a very comprehensive project. And what it was is actually looking at the immunization rates of patients up to 24 months. And if you could imagine, you know, as a pediatrician or a pediatric team, this was something that was really important. It was one of those key measurements that the state of Oregon was looking at as a quality improvement initiative. So I'll go over that, and then I'll leave probably another 10 minutes will just be an open dialogue for people if you have any issues or just things that you want to share with the group, or if you have questions for me in particular. Okay, so let me share with you that particular slide. So once again, you'll get to this presentation. Now, this project has a table of contents. It has a lot of different elements, but we're going to look at the objectives, why this project was important, the target, which is the measurement, and the roles that were involved. These are the individuals that are internal customers. Then we'll review the process flow, and then how we evaluated the program to really determine its success or not. Oops, let me go ahead and queue up my screen here for this one. Okay, so we're going to look at the objectives, which is on page 4. So with this quality improvement project, we have what's called an alert IIS system in the state of Oregon. Whenever there's immunizations that are administered, it goes into the state system. And so what this project was looking at patients that are up to 24 months. And we wanted to increase the immunization rate. So I'm not a clinician, but we needed to know that in this project, we needed to have a pediatric team to be part of it. And so the objective was to improve it. And part of this process that we looked at is how we're going to handle calls if the patient or legal guardian returns the call back regarding what's due. Part of this project was looking at scrubbing for immunizations, and that means when the MA knows that a patient's coming in, they're able to look at the current status of the immunization and prepare for the visit. And then when the patient actually comes in for the visit, we administer the proper immunizations. So really important, why is this relevant? So if what we identified in this project was fully immunizing the kids based on these schedules helps protect them from common illnesses. Though vaccines have side effects, it's generally safe. So when I do a quality improvement initiative, it's always important to ask, why is this important, not just to the clinician, but also to the patient? What's in it for them? So the target here was the percent of children. So this is the denominator and the numerator with up-to-date immunizations. The overall goal of greater or equal to 85%. We looked at all the team members that were involved in this process. We needed the front desk. We needed what's called panel managers. Panel managers and the care teams are individuals that help look at all the immunizations and help scrub for it. Once again, scrubbing means when we're looking at a patient that's coming in, what's due. The supporting staff, which is a CMA certified medical assistant or an LPN. We also identified a community health nurse that could help in this particular improvement project. And then of course the PCP. Okay, so once again, what is this thing that we're measuring? What are we trying to identify as success? We've identified that the rate of immunization is how we're going to identify success. Okay, so the next screen that I'm going to share with you is going to, I think it's on page 8, which is the process flow. Now, when I do these, the concept is Kaizen, and it came from lean manufacturing. And what a Kaizen event is you get a group of individuals that's part of this process. We've identified it, the LPNs or the CMA, the front desk, the nurse, the PCP. I get them in a room and we look at the current state. And then we look at all these gaps in the process to improve it. So if you could imagine, it was not as effective as efficient, but once we went through this project, we simplified it. And this is an example of what we came up with as a final improved product. So the data analyst comes here, we're like, yeah, we need to have a data person here to help generate these reports. So that's in here. The way this is set up as well is depending on each particular process step, we have a job aid, which is signified in this green visual. And if you are a data analyst, big picture, we know what your role is because systematically, yep, the data analyst needs to give us the data. But this job aid, if we were to go to page 11 per se, it gives me the details of what actually needs to happen and the information that needs to be generated to help with this particular measurement. So this is geared towards the data analyst to help them identify how to do this particular specific step. And I'm not going to bore you with it, but once again, this is a resource for you to see a quality improvement project that I worked on, and maybe you could get something out of this. Hopefully you do. If not, that's okay too. It's out there for you to use in the future. But as you can see, we identified what the panel manager does in this process, decision points that are signified in a yellow diamond, and job aids. So if we were to go to page 15, what this represents is that I'm a panel manager. If I'm reviewing the not up-to-date immunization, and I need more details about this, I would go to page 15. And then it'll tell me specifically how to do that particular step. And that's what we call the job aid. Okay. So let me see what other things I wanted to highlight. So we looked at target, roles involved. We looked at the process flow. So we're going to go to page 32. And then you'll see the data as far as. So this is a dashboard that this organization came up with. And what it just does is it says, overall, here's all the key performance indicators that we have for clinical outcomes here, as well as process outcomes that needs to be improved or we want to improve. But if you'll notice under this section where it has the red arrow, that's where it signifies the up-to-date immunization for this particular data point. Okay. So I'm going to exit out of this and stop sharing. Any questions about that? Once again, it's just to highlight the key things that we wanted to address as objectives and how it can be used and implemented in a big system-wide project. Any comments, concerns about that? Okay. So we have a little bit more time together, a lot of information that I've shared with you, but I want to just open the floor to anybody that has any clarifying questions or an issue that they're coming up at work related to any of these objectives that I could help with or the team could help with.
This is William. So I know I'm probably an offshoot from everyone else in the room. Yeah, I guess my question is, if we are considering like key performance indicators, I know you provide like a link to where I guess a lot of them are, yet if you're working, like I work in social determinants of health, and my assumption is a lot of key indicators are not standardized across states or systems. And so what would you kind of recommend as people are considering key performance indicators if they're not necessarily a standard in the field or in that service line?
Yeah, so tell me more a little bit about your organization. So you're looking at social determinants of health. Are you a clinic? Are you a community partner?
So we are a clinic, we're Legacy Community Health, so we're a federally qualified health center. At our clinics, at the time of the well visit, we're screening patients for any food insecurity, housing instability, financial assistance needs, so rental utility assistance, and then if they need transportation to another medical visit. So we screen them and we kind of input that in the EMR. And then our interns and some unpaid interns follow up with that person to get them connected to a community-based resource.
Yeah. So I guess in the very little time that I have, but William, feel free to email me and I can schedule time to just kind of powwow offline. When I do this work, you know, we look at the patient visit. The social determinants of health is what I bring to the discussion as interventions to help address that particular outcome issue. The reason this is also important is because you're an expert on social determinants of health, but the clinicians, the frontline staff, the nurses, they may not be educated on it. The social determinants of health, that is what you look at to help address these issues. So one example, as you said, is transportation. That has to do with social determinants of health. So let's say that you have a pediatric team and they're noticing in their data that, you know what, our pregnant mothers are not coming in within their first 3 months. And that is critical because they have to do all these panels, lab panels. You are an internal customer that is available, not every organization has. So I would be an advocate to say, hey, I'm William, can I be part of this quality improvement thing? Well, why? Well, here's why. I'm a department that will bring value into this discussion because social determinants of health, and you tell them your spiel. Because they may just simply look at it as a pediatric team that they can't make it to the appointment. And I've heard this, they're like, God, can't they just make it here? Because they're in their silo, they just want them to come in. But you come into the picture and say, let's look at it from a social determinants of health. Let me educate you on what that looks like. Hey, by the way, do you know that according to social determinants of health, transportation is one of those issues? And here's why. Because they may be low socioeconomic and they don't have the means. Now you're taking out these silos from these pediatricians, these front desks. And it's not to say you're good or bad. It's just to say, look at internal stakeholders and let's start bringing them into the discussion. So you may not necessarily have a specific measurement for that social determinant of health. In my practice, that is part of the discussion to find a solution. Does that help, William?
It does. Thank you.
Now, here's where it could be a success for your program, is to say, as an initiative, my organization is going to do 5 system-wide quality improvement programs. And as a measurement on all 5, we're going to bring in social determinants of health. And that's just to justify what you do naturally. And I could guarantee you, if you compare that to maybe 5 years ago when that wasn't looked at, the solutions would not be there as if you were to bring someone with your background in. Yeah,
Thank you.
It makes, I mean, to me, it's so exciting when you just bring internal customers that may not have been thought of, but this practice will help challenge us as a group to think about who can we bring in. Yeah. Thank you, William. That was a great question. As you can tell, I love this stuff because now I'm getting animated. Any other questions or comments? Well, let me ask, what do you all like about today's session and what can I do to improve? I'm here to learn as well. So just shout it out.
I loved all the examples.
Oh, good. Okay. Well, I have a lot of them, and I think the examples is what really is more important than actually throwing out a bunch of theories. So thank you for that validation and my stories and what I bring to the table when it comes to the things I experience. Okay.
I agree. You made it easy to follow and understand. And then I enjoyed looking at your example of how you put it all together in your report.
Okay. Thank you, Veronica. Anything else? I'm writing notes down, by the way. So I really take these to heart because I want to make sure that I'm able to provide information that is useful to you all when I present, not just to you all, but others that are interested in this information.
We will also be sending out survey. So that will also be another opportunity for you to include your concerns, comments about today's session. And Florence, I'll make sure to forward those to you.
Yeah, I appreciate it.
Any other questions before we close?
So let me just share my contact now. I know you'll get the presentation, but if you want to jot down my contact information, it's right there. So I know it's kind of long, but it's fgerber@marianoandassociates.com. And I'll put it on the chat as well. Well, I may not be able to get there before the session stops. So you'll have it on the slides when Sajida sends it out to you all.
Yeah. All right, that closes our session for today. Thank you all for joining us and hope to see you all next week. Please be on the lookout for my email for the survey and also the CEUs that will be attaching to those emails. But As always, thank you so much for joining today. And Florence, thank you so much for giving us the time and an amazing session today. It was really informational for sure.
Yeah, well, I enjoy being here. Thank you for having me.
Thank
So
you.
do you want me to stay for a little bit or are we good?
I think we're good. I have your slides, so we're good.
Okay.
All right.
Have a
Take
great
care,
rest of the day,
everyone.
everybody. Take care.
Bye.
Thank you.
Thank you.
Thank you.